Welcome to Colombia! Today we're going to talk everything about medical advice, prevention, medication, first aid kit, everything you need to know before coming to Colombia, and then everything you need to know in Colombia. So welcome everybody to another episode of Colombiafrank Talks. Today we have Dr. Natalia. She's a medical doctor here in Colombia, and she will tell us everything we need to know, or everything you need to know before coming to Colombia. So Natalia, thank you very much for having this interview with us.
No,
and we're really glad. So Colombia is a tropical country.
Yes, it is.
So it differs very to, let's say, Switzerland. We have all the tropical diseases because it's the most biodiverse country in the world after Brazil. And this also reflects in the diseases, in insects, in everything. But there are exceptions. For example, we are here in Bogota, and Bogota is on 2,600 meters above sea level. And this means we're above 1,800 meters above sea level, which is the critical frontier.
Yes.
And you will explain us why.
Okay, so that is the level in which a certain mosquito is going to reproduce. So this mosquito is called the Aedes aegypti, but you don't care about that. That's where you can find the mosquito. He is the one that carries certain diseases like dengue, malaria, yellow fever, chikungunya also. So most of the tropical diseases that you can find here in Colombia are below that level. So for example, Choco, or in the Caribbean, you can find those diseases. That is where you would need to be most prevented, or you need to have certain measures to take these diseases to your country. These measures that you actually need to take into account are, first, having a mosquito net when you are going to sleep outside. So if you're gonna hang your hammock and just sleep there during a long period or during your vacation, you need to have a mosquito net. The repellents that you need to use every day, at least 2 times a day, before going to sleep or after you shower, they need to have a component that is called a DEET. This is the only thing that has been proved that is going to prevent mosquitoes from biting you. That's the only thing. So those are the 2 things that you need to take into account. These mosquitoes are going to be found near waters that are not treated, near waters that maybe are filthy, so you need to stay away from them. Apart from that, I think that's the most important thing you can actively do to prevent the bites.
So there's actually different repellent. Some have a very low level of DET and some have a much higher.
Yeah.
What's the difference with those repellents, which have a low one and the higher one? Which one you would recommend?
I would recommend the higher one if you are an adult, a healthy adult. For example, kids cannot have this applied on their skin. Small kids, like less than 2 years old, because this is toxic. As it is toxic for the mosquitoes, it might be toxic for small kids whose skin is not that mature and developed as a full-grown person. It's not that the higher level of DET that you're going to put on your skin, that's the most protection you're going to get. That's not how it works, but it actually, just the fact that it has the component, that is just perfect.
How can we prevent, besides repellent and mosquito net, or also having air condition in the room where you're sleeping, that also kills or prevents you from mosquito bites? What else can we do against malaria?
It is really difficult to fight those diseases in a place where there are people who are sick. Malaria is transmitted because the mosquito bites a person who is sick, who has malaria, and then transports it. That's why it's called a vector. It transports it to a person who is perfectly healthy, and there is malaria in a previously healthy person.
Let's say I'm having malaria, the mosquito bites me, then he jumps over to you, bites you, you have malaria too.
Yes,
It's
that's how it works.
100%.
No. I mean, it depends on the viral amount, the amount of virus that the mosquito has. It depends on a lot of things,
Okay.
actually. But that is why in regions where there is a high level of malaria, that you are mostly at risk of getting malaria, because there are a lot of people who have malaria.
Okay.
So it's not direct contact. You need the vector, you need the mosquito to get malaria, but still there is a lot more risk in those regions.
Malaria just can be transmitted from humans to humans or also from animals to humans?
From animals to humans, yes. They do not show the disease
Yeah.
the same way we do.
There's no vaccine for malaria.
No.
I went to Iquitos in Peru, the Amazon, and we had to take pills like 10 days in advance and then continuously. What does that do?
I think you're talking about vitamin B1 or thiamine. There has been a lot of studies that have not shown consistent conclusions about that certain vitamin that would help you kind of repel yourself without putting any repellent or anything. Repel the mosquitoes from your skin if you take them like 10 days in advance from the trip that you're doing. I have taken those pills and they have worked for me.
Okay.
But that is my experience as a traveler or as a doctor, but it has not been written, like scientifically proven that it works. I would recommend it. It's vitamin, so.
Okay. But there's no other prevention. The only prevention for malaria is actually repellent, good clothes,
Yeah,
protect your skin
yes it is.
all the time.
Yeah.
Then we have another one, dengue, which is very famous.
Dengue, yes. Basically, it is a virus, and it is not a parasite like the malaria. It is a virus, a different type of microorganism. It's endemic in here, dengue, and we can see it a lot, especially in Antioquia. I worked for a period of time in Medellin, so I saw a lot of dengue in Bogota. I've never seen a patient with dengue. It's the same about the regions. It's funny because dengue does not, you do not even treat dengue. You just see the patient and you're like, okay, drink water and be hydrated and maybe treat the pain. You actually need to be careful with mosquitoes, be careful with the places you visit. If you have the risk, if you know that there are waters that may not be treated, filthy waters, well, you take the same preventions, yes, that I already said. It's the same because they are all they all travel through mosquito. The thing you need to really take into account is that you need to prevent mosquitoes from biting you.
Okay, dengue, there's a vaccination?
Yes and no. It's like the vaccines that have gone out to the market, they are not effective. We don't use it. We do not demand the vaccine for Colombia or any other country. It does not work that well, so there's no evidence that it actually works. Don't do it. No.
Next one, yellow fever.
Yellow fever.
That's a very famous one.
That's a very famous one. It's not that common anymore because there's a vaccine, and Colombian kids all need to get the vaccine. So if you are going to tropical areas, to places where there are mosquitoes, you need to get the vaccine. I know that, for example, in Brazil, you have to have it in order to enter the country. It is not a requirement in here in Colombia, but still get it because you don't know where you're gonna go next in our country.
Do we have some hotspots for yellow fever in Colombia?
Same places where malaria, where dengue, where chikungunya or SIKA are, because the yellow fever is transported by the same type of mosquito.
Okay.
By the Aedes aegypti. It is the same vector that transports or that moves the disease from one body to the other.
Then we have SIKA. SIKA is only known to the public a couple of years.
Yeah.
Something new invention from nature, or what's going on?
All of these diseases, these tropical diseases, have come from animals. So animals, the mosquito bite the animal, he gets the disease, and then he transports the disease, or he gets the disease to the human. So SIKA is not new. They have come to this continent early. That's why we recently know them, but they have been in Africa for a long time. There's no vaccine. It's very new, the disease. We don't know a lot of things about this. We know that pregnant women who get the SIKA, they might have malformations on the fetus, so that is why we are really scared about SIKA. But apart from that, on a healthy person, it's gonna get some pretty bad symptoms. We don't have a treatment. We don't have a drug that I'm gonna say, yes, this will cure you from SIKA. No, you just let it go.
So those are the 4 ones I know, but there is more. Not so much
Yes.
no ones to the public.
Yes, there are a lot more. Those are the most common in here in Colombia. There is leishmaniasis, histoplasmosis. There are a lot of diseases, parasites, viruses, bacteria that might be considered tropical, but still I think those are the most important ones that travelers must take into account when they're coming to Colombia. There are a lot of other diseases that are not tropical that might get you into trouble when you're traveling. For example, just a diarrhea that will mess up your plans, but you can prevent them by washing hands. In countries like Colombia, when you get to live all your life in Colombia, you don't get sick by these things. But people who come from other countries, they do, and they come here and they drink a little water and they get a really bad vomiting, diarrhea, they get really sick, they get fever. The water in here, you can drink it. In Bogota, you can drink water from the tap. You can drink water in Medellin. In big cities, you can drink water from the tap. But don't take the risk if you're not in a city, if you're not in a place where you know there's water you can drink.
Yeah, wash your hands. Also, if you shake hands of Colombians, wash your hands. I would say 90% of the men don't wash their hands after going to the washroom. Sorry telling you that, but that's true. So we have many diseases, many risks in Colombia, and lots can be prevented. When would it be time to consult a doctor? Okay. When you feel like what, or when you have which symptoms?
That is really important. There's a gut that tells you I need to go to the doctor. This is not normal. Things that you need to take into account: fever, but not just fever, but high fever or fever that goes for more than 2 days, 3 days, you need to go to the ER. If you're vomiting and you cannot eat anything, but you just vomit everything you're eating, also that, because you're gonna get dehydrated. If you have a diarrhea that won't stop, that you eat something and you just basically go to the bathroom right away, you need to go to the ER. If you have a rash, you need to go, because that is maybe one of the most characteristic symptoms of dengue, of SIKA and chikungunya. If you have pain on your joints and you feel like you cannot even get out of bed because you have pain all over your body, I think those are it. Of course, the other symptoms that you will have on any other country, even if if you have a headache, a really bad headache, but you can have it here or you can have it at home.
So let's talk about preparation.
Okay.
What should travelers do at home already before coming to Colombia?
Okay, first go to the doctor. Go to your doctor and make sure you are perfect. That you have, in case you're taking any medication, that you have enough medication to take to your trip, and maybe a little extra in case you lose it or in case you need it.
But are we talking about everybody? I mean,
everybody.
Somebody like me who's young, healthy, do I need to make a checkup before traveling to Colombia?
I mean, if you're coming for 2 weeks, 3 weeks, I don't think so. But if you're traveling for a long time, that most people not just come to Colombia, but they go through South America and they travel for months, they should do it. Like, prevent things happening that will mess up your trip.
So let's talk about people coming 2 or 3 weeks to Colombia. Which ones should go and make a checkup? Which are the risk segments?
Okay, so if you are having any symptom that maybe you think is gonna mess up your life a little bit during the trip, do it. And if you're going to travel to a country where you know that there are certain diseases that are endemic in here, well, you better at least know that you're healthy before you go. But if you are going to travel and try things and just try different food, if I'm going to India, for example, where I know that there is tuberculosis, yes, well, I shall check myself before you do it. I would say yes, do the checkup. Go to the dentist, also do it, because there's nothing worse than a teeth pain outside your house.
So first, make sure you're healthy. If you feel the need, go to the doctor, make a checkup. If you have special medication, get enough from it. And then yellow fever vaccination in your home country. It takes how much time in advance you have to vaccine?
You can actually do it in the airport, but I would recommend it 2-3 weeks in advance.
Okay. Let's talk a bit more about the health system generally here in Colombia and what people need to take into account when they really have an emergency and need to go to a hospital or a doctor.
There are certain special things about Colombia, very autochthonous, and it is you can get any medication you want from drugstores because it is really easy, even if you don't have a prescription from your doctor. So if you have a certain painkiller that you actually forgot to bring, you can get it in the nearest drugstore. In Colombia, you can buy medical insurance. One thing you have to take into account, really important, is that you have to check which hospitals your insurance covers. So if you might get to some place where it actually has no coverage.
Let's say I'm not living in Colombia, I'm just a traveler. So I'm coming from Switzerland to Colombia and I have an accident and break my leg. And then I want to go to the hospital for treatment.
You'll need to, I don't know specifically for every insurance, but I know that you'll need to go on Google which are the places that are going to be available for you with that insurance.
So I have to talk to my insurance provider and ask them in Colombia which providers I have access to.
Yeah.
And in general, the medical system, is it good in Colombia?
I think it is good. We got really good professionals. We have a lot of specialties. There are all types of hospitals. You're gonna see really poor hospitals. We are a developing country, so we still have a lot of flaws in our system, but you still have some very qualified centers that will treat everything you need.
So as a foreigner, you always want to receive the best treatment. So the top tier in Colombia, I would say Santa Fe comes to my mind.
Yeah, that was really good. Santa Fe, Fundación Cardioinfantil, in Medellín, Pablo Tobón Uribe.
When we're talking about those, compared to an international standard, where are they?
Yes, I think they are. The best of this country, they are in the international standard. They can be really easily compared. Of course not Johns Hopkins, of course not the Mayo Clinic, but we have pretty much everything.
And also, we're going to talk about everything about medical stuff in Colombia. If you want to have more information, we wrote a great blog with the regions and all the diseases, or some of the diseases. You will find it in the link in the description. Just click it and you get on the homepage with this great blog. So thanks for watching. I say goodbye from Colombia with Doctora Natalia. Thanks for watching. I hope we see you again soon on our channel or in Colombia. I hope you subscribe to the channel and give us a like, and that's it for today. See you soon. Bye bye from Colombia. Yours, Colombiafrank.